So our story begins a little over 4 years ago. On September 29th, 2014, my husband, Matt, and I became parents for the second time. Evelyn Ruth Jalazo, also cute. This is going to be a story of cute kids today. Was born after a fast and unexpected VBAC about 10 days before her due date. She was a picture of perfection to me, though I'm not naive and know all new moms think the same. She was 6 pounds, 7 ounces of sweet newborn perfection with a hint of red hair and a feisty spirit that left us wondering if we should have gone with our number 2 name, Martha Jane, after my grandmother. Evelyn was born after an uneventful, very much wanted and very planned pregnancy. All the ultrasounds had been normal, leaving no reason for concern. And in so many ways, I wanted to believe that there was no reason for concern. But at about 5 days old, when she just really couldn't get the hang of breastfeeding, unlike her big sister just 2 years before, like all new moms, I started to worry a little. Her early struggles with feeding would be the harbinger of our journey to come, but in our sleep-deprived state, we just wanted to believe her pediatrician, the reassurance that we got that she'd get the hang of it like her sister did. After months of countless weight checks and continued poor weight gain, despite many visits with lactation specialists and feeding experts, we found ourselves at a specialist office, a gastroenterologist, discussing medications and the possibility of a feeding tube to help her grow. Explained away as reflux, we reassured ourselves that with time she'd figure it out and catch up. But as time continued, our concerns only grew. We were dismissed by local early intervention specialists when she wasn't meeting milestones because she wasn't delayed enough, and reassured that this is just what happens to kids with reflux. I also didn't go back to work at 8 weeks as a prestigious research fellow as planned, because how do you leave a kid who's failing to thrive when you're spending 20 to 22 hours a day feeding? And our diagnostic journey just seemed to be ramping up. At 4 months, I became less patient about my mounting concerns and pushed harder on her pediatrician to think about what else might be going on, but again was met with more reassurance. After her 9-month well visit, when she still wasn't gaining weight appropriately, still not rolling, and trying to sit as children half her age should be doing, I pulled a professional favor card and had her evaluated at Kennedy Krieger Institute. You see, I was the pediatric chief resident at Johns Hopkins at the time. A quick call to a colleague who was more than happy to see her as a professional courtesy, and she was in. A developmental specialist saw Evelyn in 72 hours, when most kids would have waited another 6 to 12 months for that sort of appointment. 6 to 12 months of what can only be described as agony. Wondering in every second of every day what could connect all the dots and what could explain what's going on with your child. As a mom, I can assure you this is an all-consuming thought. This isn't a fleeting thought that pops into your head when you're washing dishes or folding laundry. This is one of those soul-crushing, pervasive obsessions that consumes every moment of every day. Scouring pictures for clues, reading other testimonies of children with similar delays and troubles, hoping against odds that she's going to catch up. Our privilege in expediting this workup is not lost on me, and I'm thankful every day for life's path that ended our diagnostic odyssey months before it should have. Months or even years before most kids with her diagnosis. On August 17th, 2015, Evelyn was diagnosed with Angelman syndrome. Angelman syndrome is a rare neurogenetic syndrome, resulting usually from a deletion of a small portion of chromosome 15. Individuals with Angelman syndrome have severe intellectual disability and global developmental delays. 90% of individuals with Angelman syndrome have difficult to control epilepsy, and Evelyn is no exception. Individuals with Angelman syndrome also have lifelong coordination and balance problems and are largely nonverbal. But perhaps most challenging to families and caregivers, individuals with Angelman syndrome have severely disturbed sleep patterns, and many sleep less than 6 hours a day, requiring near 24-hour supervision for safety. It's not all bad news, though. Individuals with Angelman syndrome have a wonderful disposition with an easily excitable personality and happy demeanor. Evelyn is also no exception here. She's a wonderfully happy child who faces many challenges every day with amazing resilience and determination. She's thriving now with an immense community and family support because of her diagnosis, because we know what she's capable of, and because we know what we're dealing with and how to walk the path forward. We spent 313 days on our diagnostic journey, though I'd argue it was better characterized as an odyssey of persistence and torture. 313 days that we could have started the process of grieving and acceptance. 313 days that we could have been doing aggressive early intervention to give her the best chance and not just hoping against the odds that she'd catch up. 313 days that we could have been building our team of Angelman warriors who would teach us that what you read in the literature doesn't do justice to what our kids can and will do. 313 days that we could have been raising awareness and the astronomical amount of money that it will take us to move emerging therapies into the clinical arena. 313 days that we could have been lobbying Congress to get Angelman syndrome added to the newborn screening panels, because as we move these therapeutics into clinical trials, early diagnosis will be critical. Thankfully, Angelman syndrome is not degenerative. Evelyn has a largely structurally normal brain, and we believe that gene therapy will be transformative for Evelyn and her friends. Replace the missing protein, and she should be able to start to learn more typically. Any improvements in communication, balance, and seizure control would be monumental to our families. As an aside, our genetic testing was not approved. Our insurance company, despite the fact that it was diagnostic, the testing was diagnostic, it gave us a diagnosis, denied coverage. It was deemed experimental and saddled our family with a $7,000 bill. I often meet resistance in the medical and lay communities when discussing the importance of making a diagnosis. I'm often asked, how is it helpful to have a diagnosis if you have no treatment and no cure? Angelman syndrome is a perfect example of this. As we stand today, there is no FDA-approved cure or really meaningful therapeutics on the market. However, as we've had more patients diagnosed and seen, we've been able to see patterns emerge. We know which medications work well for our kids and which ones don't. We know that diet can be an incredibly effective tool in the arsenal against sleep problems and seizures in Angelman syndrome. Evelyn is thriving because she has a diagnosis, because we didn't put her on the most common anti-epileptic medication when her seizures started, one that would have likely worsened her balance issues and kept her from walking. She's thriving because she's on a strict diet that profoundly helps her sleep and all of our sanity as a result, and helps with seizure control, allowing her brain to work better against all the odds. We're thriving as a family because we have a diagnosis, a community, and a path forward. I have a unique perspective on this diagnostic odyssey as a parent, but also as a physician caring for children with complex medical needs, many of which remain undiagnosed due to insurance denial of appropriate testing. Today, as a physician and a parent of a child with a rare disease, I'm asking Congress to consider Representative Swalwell's Precision Medicine Act, ensuring clinicians have access to the diagnostic tools that are deemed clinically appropriate, and not only those approved by individuals' insurance. Thank you.